Welcome to the office.
Nice to meet you.
Nice to meet you too.
How can I help you? What you doing here?
I have like a lot of lower back pain. It's been lingering for a couple years now.
Okay.
And then
Let's rewind a little bit.
Yeah.
When did all this start?
A couple years ago, I think it was when I got diagnosed with arthritis in my S1. Yeah.
Hold on, let's rewind
Oh.
now. Okay, this is good. So you
Yeah.
were diagnosed with juvenile rheumatoid arthritis.
Yes.
Just for people who don't know
Yeah.
what JRA
Yes,
is.
JRA.
When were you diagnosed with JRA?
When I was 9 years old, so 13 years ago.
And they found it where?
First it was in my right wrist, and then I got treated there, and then once that happened, once I was around 14, 15, they found it also happening in my S1 joint, in my
Okay.
lower back.
What do you know about JRA?
They told me that I've had it from when I was really young, so it's juvenile,
Yeah.
and then also it was mainly inflammation
Yeah.
and less mobility with my joints.
Okay.
So when it happened with my wrist, I did occupational therapy and stuff like that. I think that's what it was called.
Okay. Did
Yeah.
they find any erosion in the joints in the hand?
Erosion, how do you mean? As if the
There was the arthritis.
yeah
Meaning there was inflammation or there was calcification?
inflammation.
And did they give you any medication?
Yeah, it was called Enbrel. It was these injections it took.
Anti-inflammatories?
Yeah.
Okay. And are you on any medication right now?
No.
No medication right
No.
now? Let's talk about what you played sports-wise, because you have
Yeah.
a few injuries going on.
Yeah, I
And
played.
I need to explain those injuries as well, too.
Sure. I played basketball,
Yeah.
baseball, football, and those three.
You got game?
Yeah. Basketball definitely. The other
That's your
two not
game?
so much. Yeah, basketball is my main one.
What position did you play?
Point guard.
All right, so you were getting...
Yeah,
They
a
were-
lot of
they were getting you.
contact. Yeah, I
Okay.
was a smaller guy too, so I would have to do a lot.
Okay, so that makes sense. And how many years were you playing?
Since I was 5 years old,
Got
so
it. Okay.
I've been playing basketball.
Okay, cool. I want to share something about JRA.
Yeah.
And it's unique to this work because Dr. Gonstead,
Mm-hmm.
what this work is based on, was diagnosed with JRA at a very young age.
Oh, really?
And he had juvenile rheumatoid arthritis. His story is interesting. I'm just sharing what was
Yeah.
taught to me. And so he was diagnosed with JRA as a kid. He tried everything, nothing had helped him. And he found a chiropractor in Madison, Wisconsin, back in the day. And this chiropractor helped him. I mean, this guy,
Yeah.
Gonstead as a kid, he was pretty bad. The chiropractor helped him. He helped him to the point where he decided to be a chiropractor as well. And in Gonstead's career, 55 years, he saw almost every single condition of the time. And there were two conditions that they said he couldn't help,
Mm-hmm.
but there was a caveat to it. And the two conditions they said were ALS, Lou Gehrig's,
Yeah.
and JRA. Hear me out though.
Mm-hmm.
The caveat is, he said, they didn't give him enough time to help them. That's one piece of the story.
Mm-hmm.
The second piece of the story in terms of rheumatoid arthritis, whether JRA
Yeah.
or just RA. A lot of these inflammatory conditions were treated back in the 1800s by treating the gut, the digestion.
Mm-hmm.
So the digestion becomes more important long term to manage your inflammation. Okay?
Okay.
Otherwise, what happens is then you are on a regimen of meds. And that regimen is for life, so to speak. But you're young enough right now. Make those changes now. You eat more home food?
Yeah.
Okay, cool.
I don't really eat out very much.
Okay, so perfect. And we'll talk more about the digestion because there is digestion issues going on as well.
Okay.
Okay, so I'll explain all that when I go over your x-rays.
Yeah.
Now, let's go back. The number one reason you're here is your back, low back,
Yeah.
right? And is there any shooting pain down your leg?
Not down my leg, no. It's just
local.
one spot, like one general area, really.
In the center,
Lower right, right center-ish. Yeah.
lower right center. Okay,
Yeah.
all right. What makes it better? What makes it worse?
Honestly, I can't tell you what makes it worse because it just happens. I think maybe it's the way I sit sometimes, or like I'll lean back when I sit. Maybe like that can trigger it. I don't really know. What makes it feel better is like usually like I'll like put like my leg up and then like I try to go over to get like to a crack
pop,
over here.
pop
Yeah.
there. Okay.
And that's basically.
And that
it.
gives you a little temporary relief?
Sometimes it does, and sometimes it ends up making it hurt more.
Okay.
So it's really a hit or miss.
Okay.
Yeah.
And what are you doing right now? School? Work?
Yeah, I'm in school right now, and then I also work. At least I was working before none. So
You're sitting a lot.
Yeah.
So we need to talk about that too. What else do I need to know?
I think I also like have like issues with my posture, like up here. Sometimes like when I sit, I do like that turtle, like that turtleneck position. Like my mom always gives me smack for that, and I notice that I do that a lot. Maybe it affects like the way I sit. I need to work. I need to change that too, I guess.
We're going to talk about all that. And I think when I go over your x-rays, things will make a lot of sense as to what's going on.
Yeah, because you're saying there's a lot of stuff going on here, so I'm curious.
There's a few things going on. And there's a lot of good news there as well.
Okay.
So, all right. So we have low back, we have neck. I know we have digestion issues, and we want to talk about some prevention and maintenance for JRA.
Yeah.
Yeah?
Yeah.
Sound
Perfect.
good?
Let's do it.
Let's do it.
Yeah.
We're looking at posture. And the first thing on the posture is this. We're going to run a plumb line, which we're starting at the base L5 and we're taking it straight up. And the first thing you're going to notice is that you carry your upper body behind your foundation. This line should bisect 7 and 2 like this.
Okay.
So what that shows us, your upper body sits slightly behind the foundation. So these muscles here are working overtime just to kind of keep you upright. So I know it bothers you after a period of time.
Yeah.
Just sit. Yeah. So the first thing is, do we have a level base foundation? No, we don't. We can see that the pubic bone is here, the crease of the bum is here. We're here slightly tilting to the right side.
Okay.
You see what I'm talking about?
Yeah.
When we look at the width of the ilia, this is wider, this is more narrow. And what this is telling us, these are x-ray projections, right? Mm-hmm. The size tells us how it's actually misaligned on the x-ray. And the x-ray is a comparative analysis. So let's look at the numbers, and now this should make a lot of sense. What we have here is this. We have a rotated sacrum on the right side, and we have a rotated pelvis on the left side. Based on the misalignment of the left pelvis, I know there was a trauma there. So I know we've had a few traumas. That's fine. Let me explain the way it's moving. So the left pelvis, it's ASEX, it goes up and it goes out.
Okay.
The sacrum on the right side is posterior, P, 7 millimeters. So the overall effect is that your body is favoring to the right side. We have a slight short leg on the right. The measured difference, follow this now, this is important. The measured difference is the actual difference right now, which is 2 millimeters.
Okay.
If I correct your left pelvis right now, I will make it worse. So the answer is not your pelvis.
Okay.
Okay? Which means you had a tailbone injury first, and your pelvis came later.
Okay.
Whatever happened. Okay? So the fix is going to start somewhere in the tailbone.
Tailbone first. Okay.
Yes. Now, you said S1. I'm looking lower, and I'll show you what I'm talking about in a second. So in your foundation, the major is this. This is back. We correct first what? The rotation of the sacrum.
Okay.
That in itself will correct a lot of this pelvis, because it's going to bring it this way.
Okay.
Okay? So we have sacrum. Now, after sacrum, let's follow it up. Yeah, you played hard, dude.
Yeah, I hustle.
Yeah, you hustle, dude. Next thing I want you to see is this. So once the foundation is level, L5 is also off. And L5 is causing this curve, this tilt. Okay. So we have a slight, follow my process, we have a slight short leg on the right, and we have an L5 tilted up, which is causing this curvature. And this curvature then changes the pattern of the ligaments, and I'll explain. So these ligaments get shorter, these elongate. It turns, it comes back to neutral right about here.
Mm-hmm.
From here, it does what? Goes up, and then it starts to deviate to the right side. But part of all of this is because you're favoring, everything is going to your right.
Yeah.
Okay? And for you, the biggest thing is going to be the walking, okay? We'll talk about that. Now, here's the interesting part. Right about here, we can see there's another kink in here, okay?
Mm-hmm.
Follow my process. I'm going to show you something. This is actually pretty cool. So when I'm looking at the vertebrae, I'm also looking here, right, at these circles. These are called pedicles, pedicle shadows.
Yeah.
That tells me how the vertebrae are rotated. Now watch this. You can see they should be equidistant and symmetrical. Okay? These are good. These are good. This starts to get smaller, 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 smaller. Do you see it? These are smaller.
Bit, yeah.
The circles are smaller. The circle is bigger, smaller, thinner, thicker, thinner, thicker, thinner, thicker. Yes?
Yeah, I see that.
Thinner, thicker, thinner, thicker. This is really cool. Follow my process. Come on.
Uh-huh.
Thinner, thicker, thinner, thicker, thinner, thicker.
Okay.
Thinner, thicker, thinner, thicker, thinner, thicker. Where is all this coming from?
Yeah, that's all.
He has a true rotated sacrum. This is a rotated sacrum case.
Okay.
And what it's doing, it's causing everything to kind of turn with it. So we have a sacrum major that's causing all of this compensation in your body, okay? The next thing that I want us to see is this area in here controls the digestion, okay? T5, 6, 7 area, around there. T1, T2, T3, T4, T5, T6. Now, what I want you to see here is, I said they're all small, big, small, big.
Yeah.
But it gets more small or smaller at T6. And T6 is what's taking the neck out. So the majors we're seeing so far, right sacrum,
Yep.
T6 area.
Okay.
Okay, now we're going to continue up. Does that make sense so far?
Yeah.
Cool.
Yeah, that makes sense.
Then, let's go to the side. Let's look at your tailbone. And it's down low. So when we're looking at the tailbone, it should be a smooth arc. We got a little nub here and here. So when we examine you, we'll figure out where that's coming from. Now, here's my issue with you. Our discs are designed to be level and parallel, and what I want you to see, your L5 is thinning a little more than it should. And for your age, it's too much. It ain't moving. We got to get it moving. So the goal is we start on sacrum, we get it stabilized. Once that's stable, then we get to your L5.
Okay.
What I do want you to see is this, though. You see how L5 is angled? It's tilted. It's angled back.
Yeah.
Yep.
Yeah.
They're supposed to be level, and this is giving us good information. 5 is tilting, 4 is tilting, 3 is tilting, 2 is tilting. Do you see it? 1 is tilting. 12 is tilting. So all of the lumbar spine are tilting because they're compensating, is what I was showing you on the other x-ray.
Yeah.
So whatever's going on in this part is not the cause of anything.
Mm-hmm.
Take?
Okay.
Okay. Let's continue on.
So it's not the cause, but it's being affected by everything else that's
Well,
going
think
on,
about
or?
it. This is your 24-story building.
Yeah.
Your basement is out, the parking lot.
Yeah.
And that's affecting from the first floor all the way to the 14th floor,
Yeah.
as an example.
Mm-hmm.
Whatever's going on here is a result
Of
of what's going on at the bottom.
Okay.
So if we start just chasing symptoms, we're not fixing
Yeah,
anything.
because I've always felt like whenever I stand up straight, like it, just like how it looks in the X-ray, that's always like how I felt like my back was aligned, like my lower back at least. Like it's
When
just
you're
like
up.
it's curved and angled, you know. Like,
Correct. Now let's go to your neck. So in your neck, your discs are good, but this C2 is off. You can see it's a little thin in the back here. C2. Now, if I go through flexion extension, this is your neutral. In extension, they should all go back. You don't have a lot of extension in your neck. It looks like your muscles or the tissues bulge in the back, making it look like you have extension, but that's the tissues, but the bones need to move more.
Yeah.
Inflection, here's our answer now, okay? So inflection, they should all move forward. C2 didn't move forward. 3, 4, 5, C6 didn't move forward. So you have both going on, 2 and 6. We will decide which one we will start on. I will not do 6 and 2 together on the first visit.
Yeah.
Okay? It's too much. But we'll do a test to determine which one. Make sense?
Yeah, that makes sense.
Questions?
Not about the neck, no.
Okay. Foundation, clear?
Yeah, foundation. So it's over here, right?
So it's the right rotated sacrum with a slightly short leg on the right.
Mhm.
It's under 7 millimeters regardless, so there's no intervention. Anything under 7 millimeters, adjustments will hold.
Okay.
So there's no issue with that. Sacrum, something around 6 area, T6,
Yep.
C6, C7 area, and C2.
C2.
Those are your majors.
Okay.
We'll examine you, figure out where we're going to start spine, and whatever else I see we'll deal with.
Okay.
Fair enough?
Yep, fair enough.
Questions on the x-rays?
No.
Let's get started.
Alright.
I want us to look at his dimples here, okay? They should move up and down like this, number 1. Number 2, what I'm seeing is it's just very choppy in this area. It's going back and forth, left to right. Go ahead and walk, please. Keep going. Keep going. So he also walks on the outsides of his feet. He bilateral toe out with slight supination when he's walking. When we see someone like that, I know there's an upper cervical issue. That C2 is going to be an issue. And how long do you know how long you've been walking like that? Your 2 feet out like this?
As long as I can remember.
As long as you can remember?
Yeah.
Because my basketball players typically have sacrum issues with bilateral toe in. Yours is the opposite. That's what's
Yeah.
interesting. Walk on your toes, please, up high. Okay. And see, because he doesn't have that fluid movement through his foundation, his upper body, he walks like this. He's trying to walk with that Corona swag. You know? He's trying to do this when he walks. Watch him. So he kind of walks
You want me to go on my toes?
regular walking. So he's like this. Okay, keep going.
That's my walk.
Come over here, please. Have a seat. Let's get started. Starting at the base of the neck. Head down, please. And the first thing we're getting is 15 points. C7, C6, C7. Next thing we're getting, 10 points, C2. Next thing we're getting, points around T7 here. All right. Let's continue. And 5 points down low, right side of the sacrum around S3. So C2, C6, C7 around T7 and down in the sacrum S3, S4. Okay, let's check the movement of your pelvis, please. Feet together, scoot forward for me. Feet touching, feet together. Open and close your knees with your feet touching. Open wide and close. Open, close. Right side only, please. Keep going, good. When he does the right, the left is okay. There's a little bit of movement with it. Left side only, please. And when he does the left, there's movement of the right, but it's very subtle. And the reason why it's subtle is this whole thing is stiff here. Okay, scoot back for me, please. Let's do static palpation. Head down. Round your back for me, please. The other way, forward. Round your back forward. There we go. Static palpation. Starting at the base. And what we can see, you can see dishing, all this dishing here. So I see the bumps here, then they disappear from here all the way here, then they show up again here. Whenever we see it dishing in the upper back, it usually starts around T7. That's actually in one of the thing that's in Plugger's book. 1, 2, 3, 4, 5, 6. More pain at 7, more pain at 8, 7.
Sharp.
More at 6, more at 7. That's 8, starting there. 7. All right, dude. Let's see what we got going on down here. Look straight ahead. Back slowly towards me. Let me do the work. Passive range of motion. All the way back, please. Good. That's your L5, okay? Tender. Yes?
Yeah.
S1. S2. S3. More tender at 4. More tender at 3. Right there. 3. T7, S3, and I showed you what 5 felt like, right?
Yeah.
Okay. Sit back for me, sir. Let's work on the neck. Glasses off, please. And I'm just checking general movement, okay? 6, 5, 4, 3, 2, tender. Bend left. Let me have it, please. Let me have it. Passive motion. Let me have it. Oh, yeah. We'll do divorce test. Divorce test will help us determine if we're going to adjust the upper or lower cervical spine. Looking up, isolating the lower cervical, turn left. Is it tight or you're just resisting me?
No, I was actually going with it.
Okay.
I wasn't resisting.
Good. There. It's tight, but the movement is still there. Down. That doesn't move as well. Oh, C2. Okay. Give me a second here. Let's figure out your game plan. We're going to do S3 slightly on the right side. We're going to do 1, 2, 3, 4, 5, 6, 7. All right, so C7, T7, sacrum, and C2. You ready for me?
Yeah. Just tell me what to do next.
Let's do it. Let's start with your neck. Sit back for me, please. Okay, we're going to do C2 as a PL.
Yeah.
We're on the spinous of 2 right there, okay? You feel my tip of my finger?
Yeah, I feel that.
I'm going to lighten up a little bit, and I need to drop that left elbow down. Look up.
Oh. Okay.
Gotcha. Nice. Walk it off once, please.
Just like.
You okay?
Yeah. It was loud, but that was. At least it didn't hurt.
Well, it doesn't hurt. You know, people say, is it going to hurt? It's going to be, sometimes it's spicy.
Yeah.
And as you know, spicy means what?
Flavor. That's
A little bite to it, right?
Yeah,
Sometimes.
Don't mind.
Come over here. Let's go face down, please. Sacrum.
Okay.
Palms up. Receive.
Both hands or?
Both hands. There we go. So, rotated sacrum, S3. We're going to torque it slightly counterclockwise to get that right side up.
Oh.
And that's the home run, baby.
Oh shit.
Nice. Or as they say in cricket, there's a chaka 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 chaka.
Yeah, shit.
1, 2. You okay?
Yeah, that was just wow.
Deep. T7. He's tight. Relax the right shoulder. And that's the home run. Gotcha. Deep breathing. Deeper. Walk it off.
That felt really good.
You're gonna walk 4 or 5 times, okay? Take
Yeah,
your
I know,
time.
the walking
no
feels
rush. I just need to open the back of your gown, please. And let's see what's different. Go ahead. Cool.
I feel a little lighter, honestly. Yeah.
Keep walking. The key here is this, right? As I'm making structural correction with the adjustments, the walk is the most important thing.
Yeah.
So the homework is 10, 12, 15,000 steps a day.
Okay.
Okay? You figure out how you're gonna get your steps. It's not about going to the gym right now, please, okay?
Mhm.
Just, you can do your walks, hikes, swimming, you have pool, swim as much as you want. You wanna do some biking is fine, but I would just stick to the walking and hiking right now.
Like no, like what- you mean like no
No
weights
weights.
or nothing?
Not for this first week or so.
Oh, okay.
Please.
All right.
No body weights, no push-ups, no pull-ups, none of that. So
Okay.
sometimes it goes against what a lot of other people say.
Okay.
The reason why is I don't want variables. I just want the movement, the walking.
Okay. So no gym for the next. You said for the week or like how long?
I don't know right now. For
Oh.
this week though, or at least a few visits I'm seeing you,
Yeah.
just walk.
All right. Now that's gonna affect my bulk.
Walk on
That's right.
your toes. So you want to be crooked with bulk, or you want to be straight first?
No, exactly. Yeah. See, like when it comes to that, then.
You can see
I guess,
there's less kinking in your spine now when you're
Yeah.
walking on your toes. Good. Come back over here and have a seat. Let's get through a couple of visits, like I said. Let's get your movement, and then we'll make decisions. Come on, dude. Guess what? C2 is clear. That also cleared the base of your neck is clear. T7 is clear. Very nice. Sacrum is clear. Check it out. Back slowly towards me. You remember what your L5 felt like? I haven't touched
Yeah.
your L5. Check it out. All the way back.
Oh wow.
A little different, yeah?
Yeah.
S1, check it out. Come on, don't be scared. S2, check it out. S3, that's the one.
Wow.
L5. Bolo?
Yeah, I feel like I can go back a lot more movement, flexibility.
All right, spine is clear for today. Let's go ahead and tune up the rest. You ready for me?
Yep.
Okay. Next is ears.
Oh.
Shoulders. Relax the shoulder, relax the elbow down, down. There. Let me do the work, please. Let me do it. Don't help. Don't help
Try not to.
us. Let's go on your back. You can wear your glasses.
Yeah, I did sprain my left ankle like a week and a half ago. I rolled it really bad.
Okay, let's fix it. Relax the leg. AS talus, medial tilt, posterior fibula. AS talus, medial tilt, posterior fib. There you go. Sit up and turn, please. Let's buff it out now. Now you get your buff and polish. This is vibration therapy. This is not those machines that do this, okay?
Okay.
This is vibration to break up scar tissue. Five, 4, 3, 2. Walk it off one more last time, and then I want to do your hands, okay?
All right.
Now, as you're walking, you can tell me what's different overall.
I know it feels. I don't know. I feel like I'm walking more straight.
Okay.
Like sometimes I feel like I kind of go side to side, but this time around, it's a little.
The other thing I would say, please don't wear any air soles. Those shoes are fine. Anything that rubber sole.
Okay.
I would actually buy a new pair of shoes. I'm fixing your alignment as of today. Change your tires.
Okay. Perfect.
Get some new tires on your feet
Get some
today.
new shoes.
Yeah. Come over here and let's check the hands now, please. Squeeze my hand. Squeeze. Squeeze. A little bit on the elbow, posterior ulna. Relax the elbow. Drop it down. Cross. Posterior lunate. Scaphoid. Cross. Squeeze. Posterior ulna. Posterior lunate. Scaphoid. There you go. Go like that 5 times. Next visit, you get your nose job.
Oh, I thought my nose was alright.
Watch my nose videos. It's for your breath, by the way.
Oh, really?
It's for your breath.
Okay.
You have a little bit of deviation of your septum.
Oh, I thought you were joking with me at first.
Squeeze. Squeeze. Brother, we're set for today. Questions?
When would have to be like the next visit and stuff
I will
like
see
that,
you
or
in a couple of
everything?
days. I'll see you a few visits, okay?
Okay.
After 3-4 visits, we'll make some decisions. We do
Okay.
have a little bit of work to do,
Yeah.
okay? But let's see how you respond
So
first.
you said walking, is running okay, or
Running at the
doing-
moment, no.
No. So like no
Walking?
basketball, nothing. Okay.
I know it's gonna be a little tough this
Yeah.
week.
Yeah, it's all right.
Okay. Walking, hiking, swimming, biking,
Okay.
just for this week.
Okay.
All right,
All
sir?
That's fine. I'll do that.
Welcome to the office.
Yeah, thank you so much for everything. I already feel a lot less pressure in my back. So
Awesome.
it's really nice.